My name is Liana Turdatian. I am a Seneca student and I will do the cardio and gastro assessment. I am scanning the room 360 degrees and my patient's temperature is 37 degrees, which is normal. Her pulse is 105, which is tachycardia, abnormal. Blood pressure 167 over 100, which is hypertension, and rest rate is 20, which is normal. So what happens? Why did you come to hospital? Do you have any shortness of breath?
I don't think so.
Do you have any chest pain?
I have an ache in my upper chest.
Do you have any abdominal pain?
I have stomach pain, yeah.
And do you have any palpitation?
No.
Do you have any irregular heartbeats?
No, but I think it might be fast right now.
Do you have any dysphagia?
No.
Any nausea?
I'm nauseous and I vomited.
So do you have any dizziness?
No, I just feel tired.
Do you have any cardio or gastro issues?
I take a pill because my cholesterol is high and so is my blood pressure.
Do you have medication?
Yes, I take a bunch of them.
Okay, so do you have any edema?
No.
Okay, the patient's OPQ RSTU pain assessment is done. So she is offered comfort measures, lay down to the bed and given nitroglycerin sublingual to reduce chest pain, and if it doesn't help in 5 minutes can be given 2 more with 5 minutes interval. So I'm starting my assessment. In fact, inspection showed the patient is oriented to 3 place, time and person. Behavior is normal. She's cooperative. Her breathing work is normal. No shortness of breath noticed. She has a normal for ethnicity, skin color, no pallor. No edema on the feet, no lumps. The skin has no lesion, bruising, scars or striations. There is no vascular pulsation obvious notice. So I am palpating the pulse. It's carotid pulse, it's brachial, it's radial, it's femoralis, and it's dorsalis pedis. Also the capillary refill less than 3 seconds, which is normal. So I start auscultation of heart with the bell of the stethoscope. The landmarks are aortic right second, intercostal and sternal border. Pulmonic is left second intercostal and sternal border. Herb is third left intercostal and the sternal border. The tricuspid is fourth intercostal and left sternal border, and mitral is fifth intercostal and mid-clavicular line. Then there is normal heart sounds. I auscultating for the heart murmurs. Again, aortic, pulmonic, tricuspid, herb, and mitral. On mitral, I can hear the blowing soft systolic murmur. Which is a result of dysfunction of the papillary muscles. Then I auscultate with diaphragm of stethoscope the abdomen. I start from the furthest of the pain area part, the right lower quadrant, appendix, right upper quadrant, liver and gallbladder, left upper quadrant, spleen and stomach, left lower quadrant, descending colon, and in all 4 quadrants bowel sounds are heard. Then I palpate with third and fourth fingers 1-2 centimeter deep, starting from right lower quadrant, circular movement, going clockwise to right upper quadrant, then left upper quadrant and left lower quadrant to find tenderness. There is no tenderness. So there is no pulse deficit noted in apical auscultation. The situation is 63-year-old woman applied to hospital with complaint of fatigue and abdominal pain 8 out of 10, chest pain 5 out of 10, radiating to both arms starting after the breakfast, and had nausea and vomited without relief once. Assessment background. She has a history of type 2 diabetes, hyperlipidemia and hypertension, osteoarthritis. She had a total hysterectomy and a gallbladder removal. Her family history significant for father, type 2 diabetes and the hyperlipidemia, hypertension, died at the age of 70 from a myocardial infarction. So she has no known allergies. She is taking alcohol on social occasions and no smokers, not smokers. She is taking a cup of coffee daily. The patient's assessment showed the tachycardia and 105 and hypertension 167/100. Then she's oriented to 3. Behavior is normal. No edema noticed. No pulse deficit. She has she has a systolic soft blowing murmur on the mitral point, and otherwise there is no other significant changes. Recommendation: she is given nitroglycerin comfort measures, and MD assessment or MP is recommended. The patient has heart acute myocardial infarction, I think, and she needs the vitals monitoring. ECG made 12 lead and monitored, and also blood tests including cardiac enzymes. Doctor's intervention should be anti-anginal treatment, nitroglycerin IV or PCI surgical, and the bypass operation, and also the blood thinner, anticoagulants, hypotensive therapy, ACE inhibitors, and blood blockers.